the other day, I was like, you know, like this whole vial of insulin, like this is a lot of responsibility, and making the wrong move or doing the wrong thing means that like it impacts my health. And so it's not just an injection or just the timing. It's like I am literally responsible for keeping myself alive every single day. And like, I don't think people realize that it's that intense. Like people are just like, oh, you have diabetes, eat better, exercise.
Right.
I think sometimes you have a moment where you're like, well, this box really is like, I would be dead without it.
Yeah.
Right. My name is Janine Bennett, and I am 59 years old. I was diagnosed with diabetes at the age of 2, so I've had it for 57 years.
My name is Ryan Flynn. I'm an English teacher. I was diagnosed when I was 15 with type 1 diabetes. I am currently 48 years old.
I'm Kylene Redmond. I'm 43, and living with type 1 diabetes is a part of me.
My name is Josh Erith, and I am 26 years old, and I have been living with type 1 diabetes for 19 years.
My name is Mila Clark. I am 34 years old. I live with latent autoimmune diabetes in adults, and I am a nutritionist and health coach.
Have you had experienced any complications with diabetes? I myself has lost a lot of my vision as a complication. When I was 24, I started with trouble with my eyes. I had surgery in both eyes for diabetic retinopathy and a second surgery in one eye. I ended up, unfortunately, losing the vision completely in my left eye. At the age of 27, I had to stop driving, which to me, I feel so young, and it was devastating. And I'm lucky that I have a great support system. But still, I always think like, wow, I have no sense of independence. Anytime I need to go somewhere, I have to ask someone.
2 years ago, I woke up one morning and it was in my left eye. I started to notice this little spot, and it would flash whenever I blinked. I would see this little flash in my eye, and it would stay there. I went to the eye doctor, and he said, yes, you indeed do have retinopathy in my left eye. He described it as like someone playing darts for the first time and hitting bullseye on like their first try ever. And it happens to be right in the macula, which is like responsible for your central vision.
Right.
You're like faced with the fact that like you have a disease that unfortunately people go blind from. Like that fear is like one of the, without a doubt, like the scariest thing I've ever felt in my life.
I think one of the ways that I feel like type 1 diabetes has limited my independence is just like being afraid to be alone.
That's very valid.
Yeah.
Yes, yeah.
It's
Going to sleep.
Yeah. Going to sleep by myself when my partner's traveling and feeling like, okay, am I going to hear the alarm? Am I going to wake up?
Yeah.
I definitely have similar fear. I moved to Oklahoma alone, and this was the first time. You know, my family is in Maryland. They're miles away. How can they help me if I go too low or too high, or if I need help?
All of those things fall on somebody. In some cases, it's the individual, and in cases of family, it's them. In my case, it's my wife, and it's in her head 24/7. I mean, it is a symphony in my house on a daily basis with just there's something going off, and it's through a CGM and a pump and 3 phones. And the share app's just going, and somewhere there's one going off in somebody else's house. And if it wasn't for like my wife, who is absolutely 24/7 on it, because you have to be.
Yeah. When I first started dating my boyfriend, within 3 days, he bought a book called Think Like a Pancreas.
Yeah.
And I was like, that's adorable.
Keep him.
Yeah, I was just gonna say that's a
Yep,
keeper.
yeah, I love it.
It's so beautiful when the people that you care about most get so invested and care
it's
so
like a
deeply.
separate, like,
Once
love
I
link.
got married, my husband is amazing, great support. So is it my family and my friends. They're great where I work, but it was difficult because my phone was always beeping for highs, lows. Recently, we hired someone who's also type 1. And it was just such a nice peace of mind knowing that someone knew how I was feeling when I didn't feel well and vice versa.
I met my first coworker or colleague in my office that has type 1, and I had seen her around the office for years at this point, and I finally noticed a CGM on her arm, and she was diagnosed like a year ago, and she's in her 30s.
For me personally, working and being diagnosed, it's okay, how do I deliver this to my job? How do I maneuver work with this disease?
My career was definitely impacted by type 1 diabetes. I actually did a career shift before I knew that I was diagnosed. And so I kind of made the dumb decision to quit like a really, really great job with great health insurance benefits to work for myself. And then, 6 months later, type 1 diabetes. And I don't think I would have made the move that I made had I known.
It's that part of this illness that isn't talked about and people don't see, because they don't talk about why you stay at a job or why you don't pursue a career, right? I was laid off at the beginning of the year. I was at my company for 13 years, so I never thought, it's
just
autopilot
what
for
you
me,
know,
right?
yeah.
Right? It's autopilot. And I didn't panic right away. When I went back to, I'm doing my regular doctor visit, and he was like, "Oh, I'll see you next month." And I was like, "Oh, wait, no, you won't."
Yeah.
Because, I'm not paying self-pay,
Mhm.
rates like for that. And then when my friends started asking me, "Are you good on insulin and pump supplies and CGMs?" And I was like, "Well, why are y'all?" Like, "Yeah, I'm good." "Oh, I'm not good."
Yeah.
And it was that. And then maneuvering the health system without insurance.
I teach, and I've taught in 4 different grade levels. It's public school and good benefits, just generally speaking. But my wife and I were thinking about moving closer to her parents and my daughter's grandparents, just for the sake of family. And I got certified in the state and did all the stuff, and then put my applications out, and then it get closer. And then the one that sort of was at the moment like, awesome, I got interviewed, and we got down to the last couple of interviews. All of a sudden, again, because I'm trying to be a grown-up, start thinking about those things. And first thing was, let's look at benefits. Oh my God. It was, that's not happening. And I'm not in a place to change careers like that. Just the number.
You don't think about it until it. Hence the reason why I stayed where I was for 13 years. Yeah. That's adulting with an illness or disease, right?
Yeah. I feel like the thing I wish people knew is that it is so hard, but we make it look really easy.
Yeah.
Yes.
We make it look seamless and like it doesn't have an impact, and we still like get up every day, show up where we need to be, even if we're not feeling well, even if we're in the middle of doing something fun and our blood sugars are wacky, and we just like take it with stride and move on. And I think like it builds a lot of resilience. Like I feel like I am definitely a more resilient person after my diagnosis.
I think that's it. But everything that's happening to your entire body internal, like all the organs, is just so much. And then that has an immediate impact on your brain, like how you're feeling, and God knows what's happening up there. And then of course it all gets right. And then the misperception is like, now you're just ready to get back into it.
It's not black and white.
Right.
Yeah.
It's not one size fits all. And so it's like a big misconception in itself. Diabetes is not one size fits all. So our representation needs to reflect that. So I think when I initially started out, I did not see a lot of people that looked like myself.
it is so cool to see representation of Black women in type 1 diabetes because we often get left out of the conversation. It just made me feel proud of like the advocacy work and like the talking about diabetes and like making sure that everyone is included, because like I never want somebody with diabetes to feel like they don't have someone who they can relate to, or they don't have someone that like they can see in themselves. I mean, like all of us at this table, like we are all so different, and that is so wonderful. And it's like such a great representation of like diabetes doesn't happen to one kind of person. Right. And like I feel like all of us sitting here are like really like strong advocates for ourselves and like very on top of our stuff. And I have sometimes felt like I've had to be that way, or else like I wouldn't get what I needed. Yep. Right. And so like it's crazy to me to think that like you can sit in a professional's office and they are supposed to come in unbiased. They're supposed to come in like looking at you as an individual, and then it can result in something as severe as being misdiagnosed. Yes. And like, there's nothing you can do about it. You just hope that somebody helps you figure it out. Why do you think it's so common to see like people like us misdiagnosed?
I blame history. Me personally, I blame history, right? Because when people think of type 2 diabetes, they see a certain population and they automatically put age and population with this specific type of diabetes. Wait, age, community, body size, automatically, right? So when I went in, it was, oh, you're this old, you're a part of this community, you weigh this size, it's automatic. My endo, he wasn't the one, he was a part of that team that picked up on my misdiagnosis. But the one thing that he said to me early on was, this is your disease. I'm here to support you, not tell you what to do. So you tell me, what do you want? We're going to talk about it. We've discussed being lucky of having great endos, not being afraid to go into the appointment. I hear a lot of times from other people that they're scared. They dread going. Some of them don't even go because they're not heard. They get told no when they want to ask about pumps and CGMs. And, I just find it crazy. I didn't experience that, right? So when I heard someone say, oh, well, I can't get a pump because, my numbers aren't good, in my mind, I'm like, what do you mean?
One of the things that I really love about conversations with my doctor is that I went through it to find a good healthcare provider who would listen and who would understand. And
you should.
Yeah. And I'm still with the endo who diagnosed me. So he's very clear on like what my goals are, what kind of patient I am. But I think what I love is that like I was able to walk into the first meeting kind of like unencumbered and really frustrated. And I said, I just need you to listen to me. And I need to tell you what I need to tell you, and then we can talk. And having a healthcare provider that just sat back and said, okay, tell me what you have to tell me what you've been going through, what's happening, was something that was like so refreshing to me.
I've left so many endocrinology appointments like in tears before, and like now I get excited for them. Like I get to go and like be proactive about like what's next.
Yeah.
So I hope for the future of care with type 1 diabetes is that it gets to a place where we're not required to make 50 million decisions every day, and we don't have to exhaust ourselves with the amount of decisions you make subconsciously or consciously every single day.
I think it's like not often that we get to come together as people like experiencing something so similar, and just getting to have the chance to commiserate and laugh and like talk about the differences and the similarities that we experience. And so I'm just so grateful for all of you, and I'm so happy that we got to have this conversation today, because it uplifted me in a way that like I didn't expect. And I feel like just the energy that we got to share with each other is so meaningful. And it means so much to be able to know that there are people out there just like you who are experiencing similar things, and that you're just like not alone in this void. So I really appreciate all of you, and I'm so thankful to be here with you.
Thank you. I feel the same way.